Hey everyone, it's Allison Habits, your benefits administrator. That's going to be my primary role for the next month. And I wanted to check in with all team members across all locations. That would be Lafayette Veterinary Care Center, RAH Animal Hospital, and Louisiana Veterinary Specialists. We all fall under the same benefits umbrella. And we've got some changes to our plans coming up that I needed to share with you. So here's how it looks. Aside from pet benefits, which I'll discuss separately or that you're already aware of separately, we're going to focus on the other two categories of benefits that we have to give attention to this time of year. That would be your medical coverage, which is currently through Blue Cross Blue Shield. That would be also the dental and vision coverage that falls underneath that Blue Cross policy right now too. And then the second category of benefits that we have is supplemental. Again, I'm addressing everybody, whether you take advantage of these benefits or don't, or whether you qualify for them now or you don't. This process is for everyone to understand. So because we offer those benefits and because the major medical benefits are a legally required benefit to offer, we have to have you comply, and there will be some action steps at the end of this video that you'll need to take. Again, no matter if you're interested or if you're currently enrolled or if you're not interested. So what we're experiencing are changes. First, I'll talk about Blue Cross Blue Shield. That would be our medical, dental, and vision policies. Blue Cross is actually dissolving our current plan at the end of the month of March. So this is something that insurance companies do from time to time. If they have a product that they're losing money on because maybe it's a really great deal for the consumer, they can grow wise to that over time and they'll do away with it. So we've had this great plan for several years. They're dissolving it, so we have to look at other plans. So I've been doing my due diligence for the last month or so and researching different opportunities that exist for us to not have such an increase in the cost of these plans. And unfortunately, there's no such option with Blue Cross. They are raising their rates across the board, and they're doing kind of a reverse price increase in addition to that, where they'll just take an annual increase on the rate, but they will also decrease the benefits. So if we were to stay with Blue Cross, no matter which plan I chose, we would get less benefits for higher premiums and still have a very high growing number deductible and out-of-pocket expense. And I just made the decision for the group that that was not a good idea. So I know that everybody who has Blue Cross usually loves that company for a lot of extra features, for the wide acceptance and the ease of use and their online tools. However, it's just not affordable for any of us to maintain at this time. So I have made the decision for our group to move to United Healthcare. With the United Healthcare plan, I'll attach a rate sheet so you can see all these numbers together, but your premium is actually going to go down by about 4%, whereas almost annually our premium goes up 7%. So we're actually going to be saving you money. Also, for comparable care, meaning that there's still the wellness care, there's still great in-network and out-of-network care options. So for the same level of care and a lower premium, which is your out-of-pocket expense, you're also going to have a deductible that we are cutting by 2/3. So our current deductible with Blue Cross Blue Shield is $2,800 annually for an individual. And the family plans and spouse coverage and so on is even greater than that. But an individual is $2,800. And with the United plan, the individual is going to go down to $1,000 deductible. And so to save money on the premium and the deductible, the copay, which is your out-of-pocket expense at a doctor's office, is going down. The urgent care and emergency out-of-pockets are going down. Your general out-of-pocket and out-of-networks are going down. Drug copays are significantly going down, probably by about 80% of what you would pay at the pharmacy will go down, and for a great care. So I'm going to attach a few items to the emails that I'm sending out with this video. And also in any other kind of communication portals. I'm really going to just flood you with this, but it's really important. I'll send you a new rate sheet. I'll send you a provider list of where this United Healthcare plan would be accepted, and all the details that I can about the plan. So plan summaries, benefits summary, all the costs that would be involved for the different tiers that you can choose from, especially for vision and dental as well. I'll include all that information. The rate sheet where you'll see our logos on the top of it will actually be the summary. So you would know what the cost to the company is, what the cost to you is, and what different options are available to you. And a reminder of what you have to do to qualify to get those plans, which in generally speaking for medical is going to be working greater than 30 hours. Once you get a chance to look at this, the next email that you'll get will be from the enrollment portal. It's called the Employee Navigator for medical stuff. That's the one that you'll enroll on. In the future, I'll have another one that will be able to consolidate all of our benefits into one enrollment portal on. But for now, because we're changing plans this year, I wanted to stick with our old enrollment portal. So Employee Navigator, you'll get an email from them. It'll offer you all the choices for medical, dental, and vision benefits that you want to choose from. You'll make your elections there. Once you submit it, it comes to myself and my assistant Laura, and we make sure that all the data is correct and submitted on to the insurance companies and agents. And then the new plans will be effective April 1st this year, 2018. And the old plan for Blue Cross, which again would be your old Blue Cross medical, and then if you also had dental or vision or both, all those plans expire March 31st. So I'm sending this out to you now so you have time to look at the costs, look at the providers, look at the new benefits, and make those decisions for yourself and your family. But also so that you have time to conclude any care on your old plan that you may be interested in. I know a deductible reset is biannual calendar year, so you may have that experience, and I'm really, really sorry for that. There was no way that I could have predicted that this plan would dissolve, and we weren't looking to change otherwise. So I'm really sorry for this circumstance, but here we are. If you have any wellness coverage that's also resetting per annual, that may be a good time to look at that and just maximize your benefit from your old plan if you can, drug refills, that kind of thing. And then just look hard at the provider list to see, and the benefit summary to see what you may be getting out of the new plan as well, so you can make the best decisions for yourself and your family. If you have questions, I am here for you, and I will answer them all as best I can or connect you with the right department to get those taken care of. My primary office is here at Lafayette Veterinary Care Center, so you can call me at 984-7611, or you can email me, ahabits@LafayetteVets.com. I'm here to help. Just remember the timeliness on the enrollment is really important. That plan does expire March 31st. I can't stress this enough. Enrollments have to be made prior to then. The email with the enrollment portal to Employee Navigator will have all the right deadlines for you to respect to make sure that you don't experience a lapse in coverage. The last thing that I would say is insurance can kind of be tricky, but they can kind of be lenient at the same time. So sometimes cards coming in the mail, benefit summaries getting passed out to you through work, payroll deductions, those kind of things can sometimes take a little time, and there's a little bit of waxing and waning depending on the company and depending on how things are organized and put out there. So in other words, you may see a deduction from your payroll that's different before you see an insurance card or a statement of benefits in the mail. That's okay. Just know that if you follow the deadlines that I put out, that you are insured appropriately on time, and you should get confirmations of those things too. So don't freak out if you don't have an insurance card in hand by April 1st with a new provider on it. That doesn't mean that you're not covered. And if you have a medical need before then, you just call me. And we'll work that out for you. So just be patient with the process. I would expect if you are making a new election and you're going with a new insurance, that by April 15th, you should have new cards, patient summary in hand, and you should see the changes reflected in your payroll. So just be patient with that process. It kind of works on the law of averages where things happen in different orders, but overall you're taken care of on average, okay? So again, be patient. Let me know if you have any questions in the meantime. The next benefit that I'll talk about would be our supplemental coverages. And just to define that out real quick, those are products that right now we have through Colonial. Examples of supplemental coverage would be like life insurances, short-term disabilities, cancer policies, accident policies. They have a whole variety that fall into what they call a cafeteria plan, meaning that it's kind of a la carte style. You pick and choose what you want. You can set limits that are based on your specific lifestyle, your income, your family, and so on. So you can compose those how you like. These are usually the benefits that you sit down with a Colonial representative annually and confirm continued enrollment in or make changes on, and it's nothing that we've offered an electronic choice of in the past. However, we're moving that direction, and we are changing supplemental providers right now. Again, a little bit different in this case from the medical, because Colonial hasn't changed their products like Blue Cross did, but we are choosing to change your products because it's my job to shop for you to get the most bang for your buck out of an insurance. And I don't feel like Colonial is doing that across the board right now for all of our team members. And they're not offering us the best service that makes it convenient for our professional team to work through. So here's what we're choosing. Found a company called Washington National, and they offer amazing supplemental benefits. You'll get the majority of the same products that you would be getting from Colonial, the same coverages, but the cost is more, it's more compatible, I think, with what's being offered in the market. It's definitely a more competitive price. So we are going to be working to change your benefits over to them. On a cafeteria plan, you are in control of your benefit, whereas with a major medical plan, like your health insurance, your company is more of control of your plan there. So if you don't want to make the change to Washington National, if maybe you know about your life insurance policy, and you know that you've paid in a certain amount, I will encourage you to speak to the new Washington National rep and make that decision on if you want to change or if you want to keep your Colonial plan. If you keep your Colonial plans, any of the plans that you have, we will not offer payroll deduction for those. I will have a form that you can complete so that you don't have any disruption in your benefit. You can complete that form and submit it to Colonial, and it'll basically be a direct pay option, and we'll take it off of your payroll deductions with our companies. Or you can talk to the rep about changing your plans over, or you can just cancel your Colonial plans and without penalty do nothing more, nothing additional if you don't want those insurances anymore, or you can choose to enroll fresh with another company on a different product but the same type of coverage. So there's a lot of options there. And I can understand how maybe that would be really confusing to people, because I know that for my own benefits that I have for myself and my family, I will want to speak to an agent to make sure that I'm getting an apple-to-apple type of product, that I'm not going to lose money on an investment that I've made into an insurance like life insurance. So there will be particular questions. So to do that, the agents that we've hired are offering to host at each of our locations a Q&A session. At Lafayette Veterinary Care Center, because we have 24-hour shifts, they will be here for an entire day. They'll offer a meal and they'll answer questions. At Rayo Animal Hospital and Louisiana Veterinary Specialists, they'll go in for a brief amount of time and set up shop where they can present on certain products, answer questions, give you quotes. They'll have quotes prepared for everybody based on the census that we have. So you will get a specific customized folder for you with quotes on the cost of all of their products and details. So look forward to that. Just know that those are changes that we may want to make, that you may want to become a little bit more savvy of yourself. And then once you make those changes, we will send out another video with instructions like this to tell you how to enroll in those types of benefits. And that model will be called One Source. And those changes will be coming up in a couple of weeks. So as far as insurances go, again, as an employee, there are 3 options for insurance. There are 3 different categories: pet insurance and pet wellness plans being the first, medical health insurance being the second, and underneath that umbrella also falls dental and vision. And then the third would be these supplemental benefits. And our open enrollments for each fall in March and April. So it's going to kind of feel like a bang, bang, bang type of situation. But the good news is that you'll get it done with. Your payroll will be straightened out, and then you won't have any loss of coverage. It just so happens that this year we're having kind of a change type of situation on either rates, plans, or companies. And so I'm asking for your patience in letting this level out. Wait for information to come from me. If you don't get it, then I'll hold your hand through it. Again, with questions, email me, call me. It's really important that you understand and you feel in control of this. And I don't want you to feel like you're losing anything, because you'll be gaining a lot. Again, email, call me, whatever you need. I'm here for you. Thanks, and have a great day.